This morning show. You bring us live in Port Scarborough, Tobago, and we want to continue the discussion around abortion. And we have our full panel here this morning. A full host this morning. We have Miss Joeshell Dann, and we have Janae, and we have joining the discussion Nurse Gia Williams joining us this morning. Good morning and welcome to Youth Wednesdays on the Tobago Updates Morning Show. How are you this morning?
Good morning. I'm blessed.
All right, all right. So I want to leave it up to Miss Dan because and she's very much passionate about this topic because she's young and vibrant. So Miss Dan, do take it away.
Okay, good morning, Miss Williams. I hope that you're enjoying your morning thus far, right? But this morning, as you know, we are discussing abortions. Is it my body or my choice? What is your stance as a medical professional on abortion?
Okay. One, it's not something that I agree with. Um, Taking of a life is never good. And as much as it's our body, there are so many means to prevent yourself from getting pregnant. If you know you really don't want a child, there are so many means available to us as women for free in Trinidad. So you have options and means of not getting pregnant if you know you really don't want a child. But in getting pregnant and then deciding to take a life within the well, besides my personal view, within the public sector, it's not allowed. We are definitely pro-life within the public sector.
Okay, that's really interesting that you brought up that. I know that some persons get pregnant and then decide that, okay, you know what, I want to abort this child. But in worst case scenarios where you have women who, were probably raped or did not want to get this child, probably in an abusive relationship, have financial issues, do you think that circumstances could determine whether or not a woman should have an abortion?
Okay, let me address each situation that you mentioned individually. Um, if you are having financial issues, again, contraceptive is free. So if you know you're not financially equipped to, to take care of a child, then again, there are steps that you can take, again, for free to prevent yourself from becoming pregnant. In the situation of, um, I got a glimpse of something that you were saying earlier on before the break on rape. Again, within the public facility, we will not, because again, we are pro life. So, of course, we will get counselors and all this stuff to talk with you, but we will not encourage abortion. Um, we do encourage taking a baby full term, carrying a baby full term, and giving up for abortion, for adoption, sorry. So, but we won't encourage at any point in time abortion. And again, as we all are aware within our beautiful Trinidad, abortion is illegal.
All right.
It will never be encouraged.
Right. So you mentioned that you guys are pro-life, and the fact that there are so many mechanisms to prevent pregnancy in the first place. And when we segue to the issue of abortion, you mentioned that the system will prop you up. Do you believe that the view that can pro-life be insensitive to circumstances, drastic circumstances or dire circumstances where a young woman is so severely traumatized by this experience that she doesn't that bearing this child would even stuck on her mental situation, even more stress that her body may not even be able to handle. And my second part of this question is, are our facilities in the public sector equipped to facilitate these things. Somebody can become suicidal. How do we mitigate against these things? And the aftermath of bearing a child, because I mean, come on. Some might even argue, why should I be raped and bear a child for 9 months, suffer that pain, risk my life, and because the law says that I must, and there are people who are pro-life who has, very much strong views on this topic. What are your thoughts?
Okay. I'm trying to get to this question. Um, there are, our the public sector is equipped actually. Um, so if a dire situation, and I'm hoping that you understand when you say a dire situation, what we may consider to be a dire situation, right? Um, we are equipped to take a fetus under 28 weeks in a dire situation. And you know what might be dire for you may not be necessarily dire for us, right? Um, and there are psychiatrists and stuff within the public sector that is available for counseling to persons or individuals who may be going through severe depression during their pregnancies, um, maybe mentally unstable. So we have things in place, thank God for that, within the public sector to deal with or for persons for counseling in those issues. Um, can you repeat the last question, the last part of your question?
The last part of the question you already answered. The first part was dealing with the sensitivity. Uh, is it that you is it that are you aware that for those mothers who got pregnant via rape, through rape, right, and do not want to bear this child because it would stack additional unnecessary stress on them, so much so that they may become very or inordinately suicidal, right? Are you saying that it is sensitive to force them to bear this child for 9 months?
To bear this,
Yeah.
I understand what you're saying. However, I can't fully answer that because we don't really have statistics as to we don't have numbers to see as to the figures of persons who may have been um, abused that way and came to the public system seeking or was brought in by police because most rape victims will be brought into the hospital and we'll have a medical examiner examining and tests will be run and all these sort of things. So I can't say offhand because I don't have figures, right? And I could understand the trauma that a person would go through after being raped and to think that they have to bring this person's, after being a victim, you're going to be a victim a second time in bringing this person's child into the world. But then I also know of an individual who was raped and brought the child into the world. So it will vary as for person to person. So nothing that we can see is actually designed just for one person because what may affect you may not affect me, vice versa, right?
Correct.
So um, as much as it is an issue, and again, full counseling is available. And one of the things that will happen is that senior doctors will get into consultation as well to make a decision. As in, they would look at all aspects as to if this child, because with a person being stressed, that means the pressure will be elevated, right? And there's something in pregnancy called preeclampsia where you have elevated blood pressure, which is detrimental to mommy and infant or fetus, right? So a lot of factors will be put into play, will be looked at by the consultation of a group of doctors to see if, well,
Yes.
they would need to take this baby
Yes.
because the mommy may not live if she
Correct.
has to be, if you understand.
Yes. So,
So there are extenuating circumstances because, I mean, if a person has cancer and becomes pregnant, and based on the stage of the cancer, they are different based on the type of cancer and whatever. And if the mother's life is at risk, then again, with consultation and a lot of talk and talk to the family and all these things, measures are put in place to take the fetus, right?
so I
However,
have,
the mother still has to agree to it. So
right.
as much as we may give all the advice on what will happen and whatever, still the mother has to agree and sign off on it.
So my quick, and I want to answer quickly because we have a short space of time. Legally, Trinidad and Tobago bans abortion. What are your views on drafting laws that incorporates choice, for mothers who may, under certain circumstances or warranted circumstances, need an abortion? What are your thoughts?
Well, in all honesty, as a Christian, of course, I will be pro life.
Okay.
So that's my thoughts. However, as much as abortion, and we all are aware of this, as much as abortion is not legal in Trinidad and Tobago,
It happens a
it
lot.
is constantly done. It is constantly done, be it medically or surgically, it is done. So there are always loopholes to a lot of things. So as much as it's not done in the public sector. And even if a person would have taken medic, gone outside and done things medically, and the procedure was not completed or done properly, then we have to finish. I don't want to say finish, but we have to ensure that the
Correct.
mother isn't affected. So we will have to finish the procedure because it already started, and now the infant or the fetus inside of the mother isn't viable because it's already dead. Maybe portions of the fetus is already expelled. Then we have to, because if it remains in the mother will die. She'll become toxic and die. So in those instances, we will finish. We will have no other choice. And as much as it's against the law of the land, the hospital will still go on the the convention law where patients' privacy, confidentiality stands. So the police will not be informed because of patients' confidentiality. We still go on patients' confidentiality.
All right.
So I don't know if I answered your question fully there.
Yes, thank you very much.
Okay,
You're most
so
welcome.
I know you would have mentioned adoption. Do you believe in Trinidad and Tobago there are programs where, in the case that someone was probably sexually assaulted or does not want the child anymore, that they are able to give up this child for adoption without being judged by society, something that is private, so the mother feels comforted?
Um, well, there are things in place because the social work and everything will get involved in this instance if you are willing to give up your child for adoption. So the social work and stuff gets involved there. Um, I don't know the extent of how society will judge you. And society, there's nothing that we can do that prevents society from judging. As in, society will judge you even if you get pregnant and decide to have an abortion. Society will judge you just the same. So it's all up to you. You as an individual need to know, well, okay, if I'm carrying this child, but I'm unable to see about this child, and I really was not mentally or physically or financially and otherwise ready for this child, and I'm willing to give this child a chance of life and to provide happiness to someone else, because there are a lot of persons who are unable to make kids and really want kids. So I think you can't look at it as society per se, because that is a judgment call on the individual. And as I said, there's no straight line there in that instance, because it may affect you and it may not affect me as to what people may think if I give up a child for adoption. Because if I did it in my mind saying I didn't want to kill this child because I think this child could maybe be the next prime minister or the next president, I don't know. I want to give the child a chance of life. at life, then if society judges, that is society's problem as far as I can say. Can't stop society from thinking what they want to think.
Okay, guys, so we would take a break, but we'll be right back to continue this discussion. Don't forget to share the live, share the live, share the live. We'll be back.
Moving from place to place. Good morning.
Good morning and welcome back to the Tobago Updates Morning Show. It is Youth Wednesdays and we're discussing abortions, a very topical issue, something that is pertinent to society today. In studio with me this morning is Miss Gia Williams, and we have been having discussions with her thus far, some fruitful ones at that. So to continue where we left off, I know that you mentioned that you are a Christian and that you are definitely pro-life, right? We are living in Trinidad and Tobago where we have a number of different religious organizations here, and we have persons who generally do not believe in the same things that you do or any other religion for that matter. In the case where, well, we know that in the Christian view, having an abortion is seen as a sin and as something that is wrong. But in the case where somebody is an atheist, do you think that your view towards abortion could be a little bit biased as a Christian?
For me to say that it is biased, then it would be that I don't fully believe in what I believe. And I fully believe in what I believe. Just as the atheists, well, for the want of a better word, would have no belief, as in, or different beliefs from me, a total different belief system. So I could say that his view to my belief may be biased just the same, right? So I can't say that what I believe is biased, because then I'll have to say what he believes as well is being biased, as in he believing in abortion and I'm not believing in it. That his view is biased to my beliefs just the same. So if you get what I'm saying, if you understand what I'm saying.
Yes, I understand.
So yeah, so that's just my belief, and it's my belief, and I'm grateful that the law of the land agrees with my belief.
Okay, and is there a possibility that there could be some form of a middle ground between other religious organizations and the medical field? I know that some doctors are pro-life, right? Some persons within the healthcare system are pro-life like itself, right? But for other persons within the medical field who are pro-choice, right? Do you think that there could be some middle ground between religion and medicine?
Okay, so in that aspect, as long as you're working within the public healthcare system, your belief kind of goes out of the door, because you have to go with the the principles of the hospital and the law of the land. So, what you think, and that how you think something should be done, would have to be kept to yourself, because you can't, even if you think a person should have a choice, you can't decide to have an abortion, or allow or do the act of abortion in the public hospital when, hey, that's not the principles. The public health authorities are pro-life. So if you don't agree, maybe at your personal private practice, you can do, well, then the choice is yours. Although it is the law, but then the choice is yours. But within the public, and that is all I can speak about, the public health public system, because I've been working in for a number of years, within the public system, then you have to go with the laws that govern the public system. I don't know if I answered your question there.
Yes. So also, if you're making that argument, can those who might be pro-choice make the similar argument, but they just decriminalize marijuana can they not do the same to find a middle ground, for such a topic like this? Because we are talking about human rights, and human rights considers both biases. On one end, those who might be pro-choice and pro-life. I'm certain that, all things considered, you could give your thoughts on that possible middle ground. Because, laws change from time to time.
Okay, again, you- if the law of the land changes, then again, the heads that be within the healthcare system will come together, and then the decision will be made based on the change of the law of the land, right? But as it stands, the law of the land is anti-abortion. They're against abortion, right? Um, and I understand everything in people has choices, but I can tell you from working in the system how unfair it is that every 4 months we can see some same individuals coming in over and over with attempted abortions at home. So you're telling, and it's not like they did it once. Sometimes when you look at, you've seen 13 pregnancies, one living child, 13 abortions, not miscarriages, but abortions. So, one, we have to deal with all the extenuating circumstances that come about when you have you can have abortions. And when you do get pregnant, these things that could happen to you. So a lot of factors, as you said, have to be looked at because the law says this is what we are going to go with in the public system. If the law of the land changes, as I said, then consultation will take place, and I guess we will make some changes to the public system as to what can be done and what we'll do then. But as for now, we have to abide by the law of the land.
All right. I want to thank Miss Williams for joining us this morning for such a very heavy, very pertinent, and very relevant topic here in Tobago and here for us at Youth Wednesdays. We appreciate you coming and lending your expertise and even your Christian perspective here on this show relative to this topic. Guys, this brings us to the end of Youth Wednesdays and Tobago Updates morning show. On behalf of my two beautiful hosts and the studio here at Youth Wednesdays and Tobago Updates Television, we want to say thank you. And remember to share the love, share the love, share the love.